I need to fix this. The lighting is terrible. This one. Friends, thank you. Welcome. Thank you for coming. Thank you for being here. Let me clean up my space a little bit more. How are you guys doing today? I'm going to talk about diabetes, type 2 diabetes, and some things that you can do to prevent it, some things that you can do to help. If you already have it, some things that you can do to prevent it and prevent complications that come with it. Okay? Uh, Trying to make sure that all my platforms are live. This camera is horrible, but I'll manage. I'll manage it. I'll manage it. These other two cameras are good. Josephine, my namesake, God bless you. How are you? Thank you all for watching. Whichever platform you're using, I'm here. Be patient with me. Blessing. Mira, Mary, welcome. Be patient with me. I'm going to do my best to address all the comments that come. Sometimes they are faster than I can read because I'm looking for multiple platforms and I don't have a moderator currently. I'm testing these things out. Oludayo, Fatu, welcome. I have a lot in store for you, so drop a comment. Let me know where you're watching from. If you're new to my page, give me a thumbs up. Thumbs up if you're new here. Thumbs up if you're new here. Thumbs up if you're new here. If you're watching on YouTube, Facebook, TikTok, let me know you're here. Give me a thumbs up. Son, what do you need? Okay, call the dentist tomorrow. There's nothing we can do about it. Now? No. Okay, let's not talk about it. I'm live. Okay, then it's not serious then. Okay, guys, my son is distracting me. I'm only human. I have children too. How was your Sunday? How was your weekend? I can't believe it's almost time to go back to work in a few hours. This weekend flew by. This weekend flew by. Let me know where you are watching from. I need a mic. You need a mic attached to yourself if you want to do multiple platforms. Yeah, I'm I'm trying Wally. I am new to this, so I'm still trying different things. That way I can know what works best. I know there are some platforms where you can link all your social media and then just um, go live on that platform and then it goes to all the other ones. I'm not there yet. I'm training to get there. One day I will be well enough to get there. And I could even invite other people to come join me on that platform too, if I wanted to do that. All right, let's get into it. I was waiting for a few more people to join, but I don't see friends here. Let's see. Please share the live. Power tap on your screen. Share the live. We're going to talk about type 2 diabetes. We're going to talk about some things you can do to prevent it. We're going to talk about things you can do to manage it if you already have it. Things you can do to prevent complications that come with it. And things you can do to reverse it. Thank you for joining. Diabetes is something that affects millions of people, but it never gets enough attention. We don't get enough real conversations about type 2 diabetes. Honestly, we don't. Whether you've been diagnosed or know someone who has or want to protect your health, This life is for you. This life is for you. If you know someone with type 2 diabetes, if you have been diagnosed with type 2 diabetes, if you are at risk of developing type 2 diabetes, this life is for you. Show some love, give me some thumbs up. Unstoppable, how are you? Give me some thumbs up. This life is for you. Stay tuned. And let's talk more. We're going to break this in simple and empowering language that everybody can understand. Everybody can understand what I'm going to say. Guys, my name is Josie. I'm a nurse practitioner. I create healthcare content every day, and my goal is to help people who have risk of developing chronic disease do everything in their power to minimize that risk. Thank you for the likes for those of you watching on Facebook. El Terenzo, please share the live so we can reach more people. Thank you. Um, Thank you, my YouTubers, and yeah, Messa, Rome, welcome. The key things that I will be discussing today, I'm going to dive into these important topics regarding type 2 diabetes. We're going to talk about key risk factors that you should know. So, risk factors are things that increases the chance that you're going to have this disease, right? Risk factors are things that increase your chance of developing the disease. So we're going to talk about that. We are also going to talk about the diagnostic labs, the ranges, and what your numbers mean. We will also talk about how to manage diabetes with medication and lifestyle for people who have been diagnosed with diabetes. We're going to talk about strategies on how you can reverse it if you are someone who is able and willing to train Mariama to reverse type 2 diabetes. We're also going to talk about how to prevent common complications that come with type 2 diabetes. So, whether you're living with diabetes, supporting a loved one, or just wanting to learn, you are in the right place. Show some love. Thank you, Noella, for being here. Thank you for joining me. I'm waiting for you guys. Show some love. Let me know where you're watching from. Give me a thumbs up to let me know you're here. Share the live so we can reach more people. I can't be talking to myself, right? Thank you for the heartbeat. I appreciate that. I can't be talking to myself. Thank you for the stars. Thank you for the super chats. I appreciate you. All right. So we're going to start with talking about risk factors for diabetes. What puts you at risk for developing diabetes? The number one risk factor is if your parents or your sibling have it. Number one risk factor for developing type 2 diabetes is if your immediate relative has it. So, meaning your parents, your mom, your dad, your brother, your sister. If they have it, that increases your chance of developing it too. Now, what can you do if you already know that you're at risk of developing diabetes? What can you do to reduce your risk? Is making major conscious lifestyle choices. I'm sure you guys have heard some people with regards to breast cancer, some people do proactive mastectomy if they have done the testing and seen that they are at risk of developing breast cancer because their family member had it. It's not hereditary. Let me answer this question. Is diabetes hereditary? Type 1 diabetes has a potential of being hereditary, but type 2 diabetes, not so much. You just increase your risk factor of having it because a family member had it. There's probably some genetic factor, contributing factor to it, but it's not something you inherit. It's something that increases your likelihood of having it too. It's just like I think one of the famous, I'm trying to think, Hollywood actress, I think it's Angelina Jolie. who did a mastectomy because she did a genetic test and found that she was at risk of developing breast cancer. I could be wrong. Don't quote me on this, but I know there was a celebrity a couple of years ago who did that. But with diabetes, if your parents have it, it puts you at risk. If you're black, you're at a higher risk. If you're Latino, you're at a higher risk of developing type 2 diabetes. If you have a sedentary lifestyle, meaning you stay around the house all day, you don't go out for a walk, you don't go out for exercise, you don't do physical activity, that puts you at an increased risk. If you if you what's the other thing I can think of? If you guys, I'm just pulling this out of my head from memory, like risk factors of type 2 diabetes. If you are obese, overweight or obese, it puts you at an increased risk. Now you might say, Josie, what does this mean? What if my parents don't have it? My siblings don't have it and I'm obese. Why is that a risk factor? Obesity can contribute in causing insulin resistance, which make it hard for your body to use insulin properly. This happens especially or particularly for people who have a lot of adipose tissue around the midsection. This causes peripheral resistance and it also causes your body to become sensitive to insulin. A lot of people who have excess weight also um, report that they enjoy eating a lot. They stress eat, they love food, they're foodies, People who have identified as loving food eat more often than an average person. So they're eating maybe every 2, 3 hours. There's constantly food in their stomach, and their body is on a constant drive in constant production of insulin to try and metabolize the sugars that we eat. And when this happens, over a long period of time, the body becomes sensitive. And even when insulin is produced, it doesn't use it adequately. It causes it causes sugar to stay in your blood longer than it should. And when sugar sits in your blood instead of in your cells, then you develop resistance and you have high blood sugar. Now, when you have high blood sugar above the normal range is 60 to 100. That's the normal blood sugar range for anyone who wakes up first thing in the morning and have not eaten anything. Thank you guys for hanging out with me. I appreciate you guys. Thank you for loving. Thank you for sharing. Thank you. I appreciate that. Oh, I don't see any likes on TikTok. Why are you not liking my live? TikTok, show some love. I'm gonna pause that music. Show some love, friends. Show some love. Let's like the live and share. We're talking about type 2 diabetes and we just started not too long ago. My name is Josie. I'm a nurse practitioner. I create content like this every day to help people who are in need of clarity of their chronic conditions, of their even acute conditions, and how to better their overall health. Thank you for joining our power tablet. Okay, thank you for letting me know. Um, Guys, power tap on your screen. If you just keep tapping on your screen, if you're on TikTok, keep tapping on your screen. If you're on Facebook, keep hitting that heart, hitting that like button. Hola, welcome. If you are on YouTube, my YouTubers, thank you for your super chats. Thank you for your comments. Please drop one in the comment if you're here for the first time. Drop one in the comment if you're watching for the first time. My Facebook people, drop the one. Thank you for this, guys. I appreciate it. This is so encouraging. I am going to continue sharing this health nuggets with you guys every day. And as I was saying, with regards to type 2 diabetes, your risk factors are family history, obesity, sedentary lifestyle. So you could be within normal weight, but if you're sitting around and not doing a lot of movement, it can still put you at risk. Sometimes we talk about obesity and being overweight, and forget to mention that even people who are within normal weight range can still be at risk of developing type 2 diabetes, depending on other comorbidities, depending on family history. They may have other risk factors in addition to being sedentary. Normal blood sugar first thing in the morning is about 60 to 100. For people who have become insulin resistant, their numbers go up to about 120, 125 on an empty stomach. So let's say my last meal of the day was yesterday at 7 p.m. and I woke up this morning at 8 a.m. and checked my blood sugar and it was 130. That tells me that I have developed insulin resistance and I'm now pre-diabetic. Okay. Now, diabetes is diagnosed by measuring your fasting glucose. So the first blood sugar check in the morning. If that number is above 200, you are diagnosed with diabetes immediately. It's not even a debate because it's not normal for anybody who is not diabetic to have a 200 blood sugar first thing in the morning. And if you, for pregnant women, is different. They do develop something called gestational diabetes. So being pregnant also puts you at risk of developing gestational diabetes, which for most patients it goes away, but then it goes away after the baby is born, but then they're still at risk of developing type 2 diabetes later in life. And for some people, they never recover from it. It gradually becomes type 2 diabetes for them. Guys, thank you for being here. Please like the live, share, and if you can push the plus sign on your screen, the plus sign next to my picture, push that follow button, engage, engage, engage. Tap on your screen, power tap, so we can reach more people. That's how the algorithm knows that we are here, we are engaging, and we are not robots. Okay, so continue to power tap and share. There's something called A1C. A1C is the average blood sugar over a period of 3 months. Doctors will check this to determine how your average blood sugar looks like. The normal range is about 4.7 to like 5.7. No, I take that back. It's 5.7 or less is the normal range. If your A1C is 5.7 or less, is the normal range. Between 5.7 to 6.4, you're pre-diabetic. If it's over 6.4, you're diabetic. I have seen patients with an A1C of 16. So their blood sugar is like 3 to 4 times more than what it should be. These patients will have blood sugar levels of like 700 when they're diagnosed. And a lot of times, patients don't know that they have blood sugar until they become severely ill from either infections or having the frequent signs and symptoms of high blood sugar, which are frequent urination, frequent increased thirst, frequent skin infection, urinary tract infection, and stuff like that. For patients who do not go to their doctor regularly, and I have been driving this home all year, if you, particularly for those of you who are insured, if you're out there and you're insured and you're not, hi Helen, thank you for joining. If you're out there and you're insured and you are not um, on the schedule to see your doctor for the annual visit before the year runs out, then you just pay that insurance for nothing. Please be sure to go have your annual checkups done because that's when your doctor can check your blood work and compare it to what it was last year. And if you're developing something like type 2 diabetes, they can catch it because your sugar trend will be higher. They can see that and they can check your average blood sugar over the past 3 months and see what your A1C is. Okay, so thank you for coming over. Thank you for sharing the love. I really appreciate that. Okay, guys, continue to power tap. D, welcome. Continue to power tab. Let's reach more people. Thank you for the roses. Let's reach more people so the algorithm doesn't think we are a robot. So I talked about key risk factors for type 2 diabetes, labs and diagnostics, and the normal range. So normal A1C is 5.7 or lower. Normal blood sugar is 100, between 60 and 100. A lot of times we talk about the normal ranges for with regards to high blood sugar, but if it's lower than 60, you could also have some symptoms, but that's a quick fix compared to if it's high. Now, if you're diagnosed with diabetes, how do you manage it? Right? There are medications. Some people choose to do lifestyle modification first for a couple of months and go back to their checkup. Close monitoring of the blood pressure while doing that is highly recommended because if your A1C is 8, for example, your average blood sugar is sitting around 160, 1 to 180. And if you're not checking it every day, it could be 400 and you not know it. There's a risk factor to when your blood sugar is too high because it can cause organ damage, and you don't want that. Right? So some patients will choose lifestyle modification initially while closely monitoring their blood sugars, writing down the numbers, and bringing it to their doctor. Um, when that happens, when they do that, we go back and we check the A1C 3 months later. If it's getting better, then they'll continue the lifestyle modification that they initiated. And then maybe they will never need medication. But there are some patients whose um, blood sugar is so high at the time of diagnosis that they are required to be on medication. Because if somebody's blood sugar is 500, not as a healthcare provider, you cannot send them in because they came for you with they came to you with symptoms. You cannot send them in. All right, let's see what's going on these other apps. Thank you for being here. Please share to your people. Let them come and join us. As I was saying, lifestyle modification can help either manage the disease or reverse it altogether. For people who are able, they can reverse type 2 diabetes. Exercising every day, modifying your diet, so adding more protein, less fat, less carbohydrate to your diet, that helps significantly lower your blood sugar or reverse it altogether. Exercise, 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 exercise. If you do not exercise, if you think your job or the type of work you do is enough exercise, then it's not, you have not fully considered your options. Because if it were enough, then this conversation will not be had, right? We will not be having this conversation. If you're doing everything that you think you needed to do for your to reverse diabetes and it's not working, that means you need to do more. And the easiest thing you can do is balance your plate and go for a walk, extra 20 minutes every day. Because your health is your power, your health is your wealth. A trip to the emergency room can easily cost you $3,000, $4,000, right? Doing everything in your power to prevent that saves you money upfront and makes you wealthy because your health is your wealth. Okay? So things you can do to prevent common complications and live healthier, as I mentioned, is balancing your plate, exercising as much as possible, and in addition to everything else, get enough sleep. Because when you're stressed, you don't get enough sleep, your body releases cortisol, which increases your blood sugar, which your body can no longer metabolize the way it should because of whatever mechanism that is broken, because it's hard to pinpoint and say this is what is causing your diabetes. Even the endocrinologists might not know for the majority of the population who are diagnosed with diabetes. For a few for a few people, the cause of their diabetes or the cause of their type 2 diabetes is known because it could be as a result of a health complication that led to it, contributing factor from medications, from becoming sedentary because of debilitating issues, stuff like that. For somebody, for example, someone is paralyzed from waist down, and they are either in bed or in their wheelchair, they can't really do a lot of physical activity. They can manage what they eat, but in a sense, they can only do so much. So it would be hard for someone like that to reverse their diabetes. But unless maybe they do a vegetarian diet or something. But for somebody who is able to work, able to walk around their house, it's highly recommended that you add additional exercise to your routine. Thank you, friends. I appreciate the likes. I appreciate you sharing the life to other people. This is really helpful. Thank you. I'm encouraged to keep doing this. If this information is helping you, please type one in the chat. If this information is helpful, type one in the chat. Tell me one thing you have learned today. What have you learned today so far? For those of you who have been here for close to 25 minutes now, what have you learned so far about type 2 diabetes? So there are complications that come with uncontrolled type 2 diabetes. Or for somebody whose initial diagnosis came as a result of them going to their doctor for a bladder infection, and then we check your blood and see that your A1C is 10. That means your blood sugar has been staying high for a long time, and we don't know how long it has been that high. Now, we may start you on medication, but it's going to take some time for the medication to kick in. Another thing is we don't want to bring the blood sugar down too quickly, because if we bring it down too quickly, you'll feel it. So it's going to be a couple of strategies to try and bring down the blood sugar slowly but surely. And during that time, sometimes the patient may or may not have diabetes. High cholesterol. They may or may not have hypertension. But for the most part, patients who get diagnosed with diabetes at the first check of their A1C have had it for a long time and might have already developed hypertension and high cholesterol. Hey, Joseph, thank you for being here. Robert, welcome. Right? They may have already developed hypertension and high cholesterol and may now be experiencing organ damage. So, with high blood pressure and high blood sugar together, it increases your chances of developing peripheral neuropathy. Neuropathy is numbness and tingling in your fingers and your feet. It usually occurs in particular spots on the sole of your foot. It becomes, your feet become sensitive when you're walking. Seems like you're walking on pins and needles. Very painful. Some patients even need to take medication to help with the nerve pain. The nerve damage results from your blood sugar being so high and the nerves starving because they are not getting enough oxygenated blood, or the pressure is too high, so much so that it's popping the blood vessels that supply blood to those nerve endings, and they're dying off. And so it's causing scarring on the nerve tissue that didn't get fed. It's causing mini obstruction, micro obstruction, and stuff like that. Another common complication is um, hyperosmolar hyperglycemic state. This is when a patient's blood sugar is around 500-600. It causes confusion. It causes them to smell like they drank a lot of fruit juice. They smell it, and then they act as if they are drunk. They may be disoriented, confused. They feel nauseated. They may even throw up. You know, that is one of the deadliest complications of type 2 diabetes. And sometimes patients will go into a diabetic coma because their blood sugar was too high. And you have to think about it this way: when the blood sugar is too high, it Okay, I have a water bottle here. I think I have a straw here somewhere for my illustration. Where did I put my straw? So I have a water bottle, right? This is my solution that I'm putting my glasses with. I don't even know where my glasses are. But I have this solution, right? This is let's consider this blood. If I add sugar to this solution, it's going to make it thicker. So what happens when you have high blood sugar that is not controlled? It just means that there's more blood. There's more sugar in your blood than it should be. So this is your vein, and there's too much sugar inside. Now it makes your vein on the inside of it. The cholesterol that is normally inside that vein is now being broken down into smaller particles because it cannot flow freely. The blood is too big. Your body tries to make this work, right? It goes into auto mode and try to break down the cholesterol into smaller molecules so that they can pass through. But when that happens, they get stuck on the wall of the veins on the inside. It gets stuck on the inside. When those arteries and veins get clogged on the inside because the blood sugar was too thick, now it's going to say you have high cholesterol level in your blood because it's not being circulated as fast as it should, and it's not the molecular structure is being altered because of sugar. Now, when there's clogged arteries, the arteries become stiff. They become narrow and constricted. So now your blood has to push with more force. I mean, your heart has to push with more force to be able to get blood to where it needs to go. And because that pressure is too high, think about it. If you're blowing a balloon and you blow it with too much pressure, what's going to happen? It's going to pop, right? So these are like a slippery slope of complications that come with having type 2 diabetes. When the blood is thicker, let's leave the cholesterol aside. When blood is thicker, let's say you're drinking from a straw and you're drinking water from a straw. Think about it as drinking, what can I say, yogurt. No, yogurt is too thick. Maybe honey consistency. Think about it. Using a straw to drink water is how your blood flows. But when there's sugar in the blood, now it feels like you're using a straw to sip honey. So you need more pulling pressure when you're doing that. In the in the in the example for your bloodstream, your heart needs more pushing pressure to push blood out because the blood is thicker. Okay. All these are complications that can be deadly. It can become deadly because when this happens in the arteries and veins, it can happen around the arteries and veins in your heart, your legs, your brain, and sometimes you hear people have hemorrhagic stroke. Hemorrhagic stroke are caused by two things. It's either increased blood pressure that popped a weakened vessel or a weakened vessel that has been weakened over time just gave up. And then it causes a hemorrhagic stroke or a brain bleed. Or not it's non-traumatic. People can get brain bleed from accidents, but in this case, it would be from um, either increased pressure on the artery or an aneurysm. An aneurysm is a weakened blood vessel that just busted open. All this can stem from having uncontrolled diabetes. Let that sink in. Friends, thank you for being here. Please continue to like and share this live so we can reach more people. Drop a one in the chat if you're here for the first time. Let me know what you have learned so far, what interests you, and drop any questions you have in the chat. I'm looking around, I'm looking away, I'm not looking away from you. I'm trying to see who is um, on my other page that I'm live on. Thank you, friends. Let's power tap and share the live. I have one share here on TikTok. TikTok, Facebook, how are we doing? And YouTube. What's going on, friends? Let me know what your thoughts are. So far, what have you learned? If you wish to come as a guest and be up here and talk with me, send a heart to me, and I'll be happy to bring you up. Oops, what did I do? I took away my sticker. All right, guys, I have to hydrate. Stay hydrated, guys. Type 2 diabetes discussion. You guys are watching me talk. Ask questions. You guys on Facebook, ask questions. You guys on YouTube, ask questions. I can't just be talking by myself. Now, we talk about the common complications, right? How can we prevent them? The best way to prevent them and catch them early is going to your follow-up appointments, because once you're diagnosed, initially your doctor wants to see you about every 3 months. And then once your blood sugar levels have come down to a safe level, your doctor will maybe move to 6 months and maybe eventually every year. Another thing you must do is monitor your blood sugars at home. So you are checking it with breakfast, lunch, and dinner. Okay. Someone is asking, what's the best way for someone with type 2 diabetes to manage their diet on a daily basis? I'm going to give you a simple answer, but I'm not naive that these are not easy things to do. The best way to manage your diet every day as a type 2 diabetic is eating a consistent carbohydrate diet. What does that mean? That means if you're going to eat 10 grams of carbohydrate with breakfast, you should eat the same amount with lunch and with dinner. That is if you're someone who eats 3 times a day. If you eat between meals, so if you eat 3 times a day and you also eat between meals, your snacks should be consistent carb snacks. So, or preferably they should be protein. Hey Jerry, your snacks should be protein snacks, and definitely avoid any sugary drinks. Avoid any added sugar of any sort. So, a perfect meal, if I was diabetic, this would be a perfect meal for me. Um, the question that I'm attempting to answer is also dependent on the individual, because remember, your doctor is always going to tailor your care to you. Diet is subjective. What do I mean by diet being subjective? Diet is a cultural thing. Some people from different cultures eat differently. For some people, a lot of their meals contain fried food and carbohydrates. Now, in order for them to be able to manage their diet properly, they need to add more fruits and vegetables. And when I educate my patients on this, I tell them fruits and vegetables doesn't mean a variety. If you only like spinach and don't mind eating it every day, that's fine. You can eat the same vegetable every day. It's better than not eating any at all, right? If you only like a certain type of fruit, it's okay to eat only that fruit every day. Friends, thank you for being here. Please power tap and share. Power tap and share. I'll come to the next question. So I'm still answering the question about your diet and how you can manage your diet. Eating a well-balanced diet, starting with the first meal of the day. The first meal of the day is called breakfast, but it doesn't mean it has to be in the morning. If you work night shift, your breakfast time might be different from someone who works day shift. So the first meal you eat after going for long hours without eating should be a fatty. It should include fat, protein, and the fruits and vegetables. So maybe avocado and egg, some sugar-free and low-fat yogurt, and then you can add something else. that you like. You can add strawberries to your yogurt. You could add um, um, what else? Okay, that skipped my mind. But for carbohydrates, it could be a little bit of oatmeal and just the serving size. I think the serving size is like 3 spoons. Another thing that kills us when it comes to chronic conditions is that we eat 10 times the serving size of most things, which is super, super wrong. So, consistent carbohydrate diet is key to managing type 2 diabetes. If you're going to eat 2 grams of protein, 3 grams of carbohydrates, let your carbohydrate be 3 grams with every meal. What this does is it helps your blood sugar stay around the same. You don't want your blood sugar fluctuating and having too much deviation. If your blood sugar is 150 in the morning before you eat, after you eat, it should still be around 160, 170 because it goes up for everybody after they eat. But the degree to which it goes up depends on what you eat, right? It depends on what you eat. If you ate potato patties, no, no, it's not potato patties. What's that breakfast potato thing? Breakfast burrito. The blood sugar is gonna spike after you eat it. If you eat that, right? But now, if you eat like chicken breast with some low fat yogurt, some avocado, and I don't know, or egg or something, what the protein does is it slows down the metabolism. It slows down the absorption of sugar so that your blood sugar doesn't spike. It keeps your blood sugar in the uh, uh, relative range so that your blood sugar is doing this instead of doing this, right? That's the key thing with protein. And protein helps keep you fuller so you need less food. Did that answer your question, Molly? Hey friends, thank you for joining. Thank you for being here. I appreciate you. My name is Josie. I'm a nurse practitioner. I've been practicing for a little over half a decade, and I've been in healthcare well over a decade, almost 2 decades now. So I have seen a lot of challenges firsthand, and my goal is just to be here and share tips on how we can live a healthier life, even while managing chronic conditions. So let me know in the chat where you're watching from. Let me know if you have any questions. I'm going to go back and scroll to look um, and answer some questions. I am going to take a question from Facebook. Give me one moment. Hey, Matt A, how are you? How do we solve diabetes without setting foot in the hospital? That's a question from the other platform. How can we do that? Well, how does this person know that they have diabetes in the first place? Do I understand your question correctly? How do we solve diabetes without setting foot in the hospital? Preventive. Preventive is better than general hospital. So I think if I understand you correctly, you're asking what can we do to prevent diabetes and stay out of the hospital? Is managing our diet, eating a well balanced diet, eating the right portion for every meal or with every meal, um, exercising, and trying the best we can to keep our weight within a normal range. A normal BMI for an adult is 19 to 25. 25 to 30, you are overweight. If your BMI is over 30, you are obese. If your BMI is 35 and you have high blood diabetes and high cholesterol, then you are morbidly obese because you have comorbidities. If if your BMI is 45 and you have all this chronic disease or diseases, then you are severely obese, right? It's graduated like that. So, Mark, if the best way to do this is prevention, let's say you've been diagnosed already, but you don't want to take medicine. What local remedies? So, If you've been diagnosed with type 2 diabetes and you rather not take medicine, keep this in mind. It depends on what your current level of A1C is. If your and what your daily blood sugars are. If your current level is, let's make this up and say, you went to your doctor today and they checked your blood work and your A1C is 12. I strongly encourage you to start taking medicine first. The doctor can start you on some medicine to help bring it down slowly. And when it gets to less than 9 or less than 8, you can walk with your doctor and say, I want to manage this without taking medications. And it's doable as long as you, the patient, is willing to do the work that it takes. Because your doctor can only educate you and recommend the proper things to do to manage your chronic condition. It is your responsibility to go and implement these things. If you never implement them, your doctor is going to repeat the education, they're going to repeat the encouragement, they're going to repeat sensitization, and refer you to a specialist, probably, but they will never make you do anything that you don't want to do. Even if your A1C is 12, which means your average blood sugar is around 250 to 300, your doctor may prescribe medication. You may choose to not go pick it up from the pharmacy, but your doctor have done their part. And that's what matters. Your doctor is always going to do their best to do their part and help you the best way they can. It is your responsibility to implement the interventions that have been recommended, be it medication, exercise, weight loss, and so on and so forth. Back to the question, what can you do after being diagnosed with type 2 diabetes and you don't want to take medicine? I made a video earlier today, and I said if you want to reduce your A1C significantly by Thanksgiving, eat 50% less of what you ate yesterday every day. And then eventually, if you can fast, do water fasting if you can tolerate it, if you're healthy enough to do it. You can fast, for example, if your last meal is 7 p.m. and you don't eat till around 11 a.m. tomorrow, that's a 16-hour fast. That is the best thing you can do for your body for people who can tolerate it. Not everybody can tolerate it. Now, if you go to bed at 10 p.m. and you wake up at 7, you can still drink black coffee, black tea, drink water, but you are fasting from food like a meal till like 11 or noon before you eat. And when you go to eat as little as possible. Avoid your first meal being a fruit because of the sugar content. And if you have to eat, if you must eat fruit, look for fruits with low glycemic index. Fruits that have little sugar, little to no sugar, so like berries, blueberries, stuff like that. And add protein, add something with some fat in it, like low fat yogurt. I keep wanting to say the brand. I'm not supposed to because they're not paying me to say their brand. Okay. Exercise, exercise, exercise. So let's assume this patient was diagnosed today and they want to go home and manage this without medication and they're overweight. Let's say their BMI is 29. What can we do to bring your BMI to 25 in the next 6 months? You have a plan and say, okay, in the next 6 months, I'm going to lose 1 pound every week. In order for you to lose 1 pound every week, you should eat XYZ calories per day. Get a food diary and start journaling what you eat. If you used to snack in between, you may consider cutting your snack by half and eat 50% of your snack because you don't just want to stop everything. Some people can. If you are able, just fast for like 3 days and you'll see a significant turnover in your health because type 2 diabetes is reversible. Join a support group online. See what others are doing to help reverse their diabetes. That can help you too. It doesn't always, the same thing doesn't always work for everybody, but it won't hurt to try. See what other people are doing and try to do that too. Did that answer your question, Matt Eve? Join a support group, manage your diet, manage your portion size, and increase your activity level. 30 minutes a day It's a good rule of thumb, 5 days a week for exercise. All right. I'm gonna go to over here and see. I think there was a question. What's the best way for someone with diabetes to manage their diabetes and get okay? I answered that. Thank you for the lights, watch your patients, watch for things. Okay. Another question is what should patients watch for as sign that their treatment plan might need to be adjusted? So usually you are welcome, Matthew. Usually when patients are diagnosed, they're sent home with a prescription for a glucose monitor. And nowadays with technology, oh my God, there's this one that you just put on your arm or your tummy, and there's an app on your phone, and you just check it. You just like when you want to check your blood sugar, you just go and scan it, and it tells you your blood sugar. So monitoring your blood sugar is key. Um, that way, if you are having symptoms such as increased thirst, increased urination, um, frequent yeast infection for women, and frequent bladder infection for men, those are signs that your blood sugar is not being controlled. Let's assume that you were not checking it. When you start having the symptoms, you should go check your sugar. If it's too high, you feel nauseated, you feel confused, you feel like you're drunk sometime. It could lead to a condition known as hypoglycemic hyperosmolar state. When this happens, your body is producing insulin, but it's just not using it. And the fat in your bloodstream start breaking down, and it produces certain acids that causes you to get confused or feel confused or have altered mental status. Is that helpful? So monitoring your blood sugar every day is key to avoiding any significant warning signs. If your treatment is not working, you will know. But it could also be your fault because if your treatment is to take this medication 3 times a day, but you are eating whatever you want, the medication is for the damage that has already happened. If you keep eating whatever you want, you're going to cause more damage, right? And keep in mind that what you eat is not the problem. The problem is that your body can no longer process what you eat adequately, right? So what you eat is not the problem. You could be eating a normal, I don't know, balanced meal, but just in larger portion. What helps is for you to reduce the portion size. Now that your body is no longer able to process all the sugars. Some patients will stop eating um, sugary foods or sugary drinks. Some people who maybe like drinking sodas would start taking the sugar-free ones. That is good. And eventually, if you can wean yourself off of all of that, that is even better. The problem is not the drinks. The problem is your system is no longer able to metabolize the sugar in you. Because even the foods you eat, a lot of times people think that sugar is anything that tastes sweet. No, bread, wheat bread, tastes horrible, but it does have carbohydrates. And when you eat it, your body breaks down carbohydrates and converts it to sugar. So, in a way, almost every food group has some level of sugar in it. But the less you consume, the better, particularly if you're at risk with that type 2 diabetes or if you're already a patient with type 2 diabetes. I see the likes coming. Thank you guys so much. Let me see. Thank you so much. We are making progress. We are doing great. Let me see. Any other questions? No. If this is helpful, please drop a comment in the chat to let me know. Thank you for the gift. How to reverse it? Okay, I'll get to that. I'll get to how to reverse it. I talked about it earlier, but I'll go back to that. Let's see. Geneva, thank you for being here. So, how do I reverse type 2 diabetes? First things first, understanding what type 2 diabetes is, understanding what your risk factors are, or what your risk factor, what led up to this. Are you overweight? Are you a heavy drinker? Are you someone who doesn't drink water and only drink sodas, juices, smoothies? Nothing wrong with those, but your body has turned out. Are you someone who eats every 2 hours, who eats breakfast, lunch, and dinner, and eats snacks in between at bedtime? Those are some of the things that will keep you from reversing type 2 diabetes. If you eat breakfast at 9 o'clock, well, some people they eat it earlier. If you eat breakfast at 9, can you consider eating at the same time every day and then cut the snacks in between altogether? Can you consider, are you willing to walk 30 minutes a day for the rest of your life? Because if you're going to reverse this thing, it's going to be a lifestyle choice. You're going to make adjustments to your lifestyle so that you can sustain it for the rest of your life. And remember, if you can reverse that type 2 diabetes, that takes a lot of discipline. If you successfully reverse it and continue the lifestyle for the rest of your life, you may never develop another chronic condition. And statistics and studies have shown that people who walk every day have a significant increase in their life expectancy compared to any other therapy or any other intervention. Just walking every day is one of the most effective things to do for longevity of life and perhaps a better quality of life. Right? Did that answer your question? So making adjustments to your meals is one. Making adjustments to your physical activity level is another one. Guys, if you do not already know me, my name is Josie. Please see my picture right there. Click that plus sign. Touch on my nose right here on the screen, and a list of individuals who show up. Send this live to them so they can join us and we can reach more people. Power tap on your screen. That's how the algorithm know that we are humans, we are not robots. As well as drop a comment in the chat so I know that you're here and I'm not talking to myself. I hope your Sunday was great. I danced around my house. I do laps. Great, great. That's awesome. Little victories. That's awesome. I do that too because I'm sensitive to cold. So when it gets cold, I just dance. I'm from African descent, so I play Afrobeat for like an hour and just dance around. I do have a stepper, so sometimes when I'm at work on days that I work from home, I if I'm taking a call or something, I can be on my stepper and just get a few steps in at a time. Some days when I'm working from home, I'll just go outside every hour and walk around for like 3 to 5 minutes just to clear my head. That helps. That helps a lot. And another thing that we should consider is walking is really good for your overall health because one thing that keeps people sedentary is joint pain, and muscle weakness. Muscle weakness for most people is as a result of sitting in one place for too long. Because if you don't use it, you lose it. When your muscles become weaker, because think about it, no matter how strong your bones are, if your muscles cannot move, cannot move your leg, it's not going to move. Even for patients who have degenerative joint disease, one of the number one exercises is strengthening the muscles around the joint so that they can still move. Their joint can stay flexible. So exercise is really good. Whether it's dancing, Zumba, walking, anything that keeps your feet on the ground and on the move, cherish that and try to do as much of it as you can tolerate every day if possible. Thank you, friends. Please click that follow button, click that plus sign. My name is Josie. I create healthcare content every day. I'm a nurse practitioner and been doing healthcare for over almost 2 decades now. I've seen it all. I've seen it all. I tell you. The one thing I keep encouraging everyone to do is do everything you can to not get sick, even if you have the best insurance in the world. Because the goal is to live a healthier, happier life. You cannot do that if you're juggling chronic disease. You cannot do that if you're juggling um, 10 different medications and their side effects, and one doctor being pushed from one doctor's appointment to another, being prescribed one medication after another. Because with chronic conditions, even diabetes, we've been talking about it all night. When your doctor diagnoses you and starts you on the medication, there's first line of treatment. There are medications that we must try first, right? If it doesn't work, we change it to this. If it doesn't work, we change it to that, and so on and so forth till we find what works for you. Sometimes patients get discouraged when the medicine is not working for whatever reason and not follow through. And then they go back and sit and not take any actions to keep themselves, um, in check. And then it gets worse. And by the time they show up to the hospital, they have developed other complications. Complications such as I talked about neuropathy earlier. Poor circulation is another thing. And with poor circulation, you can lose sensation in your legs. And now your legs are feeling numb and tingly to the point where sometimes there are spots on your foot that you cannot feel the touch anymore. You cannot feel when you get pricked or poked anymore. And when that happens and you get a scratch and you didn't know it can develop an infection and then you realize it when it has spread. And that's why we encourage patients with type 2 diabetes to always check their feet every day, because you may have stepped on something and not know it, right? I've seen a patient come to the emergency room, they had a nail stuck in their foot and they didn't know it, they couldn't feel it. A family never came to visit them. So it developed a wound, the wound got infected. I kid you not, there were maggots in the wound, right? Because they couldn't feel it. And another thing, they were obese to the point where they could not bend over and tie their own shoes. So it was practically impossible, physically impossible for them to see the sole of their foot. So please, please, please do whatever you can in your power to keep from developing type 2 diabetes. If you are at risk, start taking measures to decrease your risk significantly so that you won't have to deal with this or any other chronic disease. Is it is it safe to always moisturize our feet with Vaseline day and night? Well, Vaseline is, I don't know if to say the petroleum jelly. If your skin is not broken, if you have intact skin, so you don't have any wound, yeah, it doesn't hurt. Any moisturizer is better than not moisturizing your feet. But if you have sores or wounds, definitely avoid that because you want the wounds to heal open to air. You can clean them with iodine that's over the counter just to keep the wound clean. But using Vaseline on broken skin is not recommended. Another complication of type 2 diabetes that I failed to mention is diabetic retinopathy, right? Where, as I said earlier, when the pressure is too high and the blood sugar is too high, two things happen. Either blood don't reach where it needs to go when it comes to smaller vessels, arteries and veins. Blood, they starve from oxygen-rich blood, and sometimes they die, and sometimes they develop scarring or scar tissue. And when that happens to your eye, you develop something called diabetic retinopathy, which happens in your retina. The retina helps us see the bright light, right? And so, having high uncontrolled blood sugar can cause that. It can also cause damage to your kidneys. Most of the people who are on dialysis today are as a result of either type 2 diabetes or um, uncontrolled hypertension. Because when those two things are uncontrolled, they cause damage to tiny vessels in the nephron. The nephron is like the colander of your kidney. Like it determines like, hey, this liquid is coming. This is what should be included in the urine. Like the amount of protein and albumin and all the little molecules that gets excreted. Your nephron determines which one passes through your urine and which one stays in your body. But when that channel is broken because of scar tissues from deprived oxygenated blood or increased pressure that busts some of the vessels open and they die, the kidney stop working at its full capacity. And then people will start developing stage 1 kidney disease, stage 2, stage 3. By stage 4, we are talking about dialysis and kidney transplant. In stage 5, you definitely need dialysis. Stage 5, most patients they don't even produce urine anymore. That's how bad it can get. So Day, how are you? So thank you, friends. Please continue to power tap and share the live. I appreciate gifts. I really, really am encouraged to keep coming back and sharing nuggets. If you're new to my page, welcome. Let me know in the chat if you're new here. If it's your first time seeing me, either here or on the For You page or ever in this social media streets. If this is your first time seeing me, drop a comment in the chat. My name is Josie. I'm a nurse practitioner and I preach proactive health because health is wealth. Health is wealth. Let me know if you have any questions. We are talking about type 2 diabetes today. Hey, Linda, thank you for coming back. We were together earlier today. So, guys, I've been doing better this week, going live more often and learning how to use all the live tools. So, I really appreciate your support. Your first time, just right. Thank you for joining my FB. Yeah, I appreciate you. All right. What else do you need me to talk about? I exhausted all the things um, I had on my list. Feel free to ask me any question. Thank you for the likes. Thank you for the share. Ask any question. Um, I'm just looking over here to see what my other friends are saying. How's everything going? I hope your weekend was great. I hope your weekend was great. Mine has been full of, I don't know how to put it, new experiences, meeting new friends like you guys. It's how my weekend went. So, patients who have type 2 diabetes, depending on their age and their comorbidities, the goal for their A1C is to stay under 9 for older people, like older people who have a lot of comorbidities and have had this for a long time. We don't want to drop their blood sugar too low because when they get sick or something, it can impact that. So the goal for their A1C is to be less than 9. There are other groups of people who want the goal to be less than 8. And for majority of the population, we want it to be less than 7. And if possible, reverse it altogether. And remember, even when thank you for the heart. Even when you reverse type 2 diabetes, you still need to keep checking, monitoring it. You need to keep checking your blood sugars every day, right? So you can monitor it properly. You guys are so nice. If you have any questions, don't hesitate to put it in the chat. Thank you for the heart to me. Thank you for joining my fan club. Thank you for subscribing to my page. I appreciate that. Sister Franca, welcome. It's good to see you. We are talking about type 2 diabetes. Please engage with my page. My name is Josie. I'm a nurse practitioner and I create healthcare content and share tips on how to live a healthier life and stay out of the hospital. Hospital, no matter how rich you are, they're not a good place for anybody. It should be the last resort. When I went to school, I was under the impression that as a primary care provider, I'll be helping people to stay out of the hospital. We'll be coming to the office and we'll go over their risk factors and talk about things they can do to decrease their risk factors and keep them from getting sick. But I found that people go to the doctor only when they're sick. People who are well and have health insurance don't even use it. They don't go for checkups because they say, "Oh, I'm fine. I never get sick. Why should I go?" But the one time you get sick and go, now we have nothing to compare with. We don't know how you were last year. We don't know what your cholesterol was last year. We don't know what your blood pressure was last year. It is not common for people to just have a blood pressure machine in their house and check their blood pressure every day. Most people only do that. I would say at least 90% of people buy a blood pressure machine after they've been diagnosed with high blood pressure. Same with blood sugar machine. People only buy it after they have been diagnosed. But if you are someone who is obese, you smoke, you drink alcohol, you drink sodas all day, you never taste water, you what are other risk factors? You already have high blood pressure. Those are risk factors. You have family history. Those are risk factors for type 2 diabetes. If I were you, I would go ahead and buy a blood sugar machine and at least check my blood sugar once a week. That way I can track it when it starts creeping up. Now, and then check it first thing in the morning before you eat. If your blood sugar is normal, when you wake up in the morning, it should be between 60 and 100. After you eat, wait 2 hours before checking your blood sugar. It might be 120 or 110, but that doesn't mean you have diabetes because you just ate. So for everybody, when they eat, blood sugar goes up a little bit more than it was at baseline. So your blood sugar might be 80 when you wake up, but after you eat, it's now at 110 or 100, depending on what you ate. If you ate something that is rich in protein, high fiber, low fat, and low carbs, then your blood sugar will not move much. Hi Elvis, welcome. Thank you for joining. Your blood sugar will not move much. But if you eat something that is high, so let's say you had potato tart and bacon, egg, and cheese, yeah, your blood sugar is going to do this, right? And it'll take time for it to come down. So those are some things that will cause insulin resistance down the line, right? So the key takeaways for today's life are things you can do to prevent type 2 diabetes, which I just finished talking about. If you know you are at risk, go ahead and buy you a glucometer. It doesn't cost much, like 20 bucks. If you can afford it, go ahead and get one. Hey Tay, thank you for joining. Just click that plus sign, follow my page. I create healthcare contents every day and I share tips to help us all live a healthier life. Because the more I share with you, the more it rings in my head and tell me that I have to do the same. Because I am also at risk. I have family history, my parents, right? So it doesn't get any closer than that. So it puts me at a higher risk of, in fact, last year I was pre-diabetic. hmm Let me tell you the story after I take a sip. Last year I was pre-diabetic. I went, excuse me, I went for my regular checkup, and lo and behold, my A1C was 5.8. Normal is 5.7 or less. Mine was 5.8. And this year when I went, it was back to 5.4, I believe, or 5.2 or thereabouts. So doctors are not exempt. Nurse practitioners are not exempt. Physician assistants are not exempt. Nurses are not. Healthcare workers are not exempt. We are all humans. We have these risk factors, right? So for me, I had to look back and see what have I been doing differently, what have I been neglecting, and try to balance and recalculate myself. A patient told me this week that they stopped going to a certain doctor because the doctor told them they were obese. And they stopped going because the doctor themselves was also obese. And if the doctor is not doing anything about their own obesity, why should they go back to them? The patient thought that the doctor was being hypocritical, but that is not necessarily so. Patients and doctors alike struggle with the same things. As human beings and the society we live in today, our food choices, our lifestyle puts us at an increased risk for a lot of chronic disease, ranging from joint disease to organ failure, right? A lot of us are at risk. The difference between you and your doctor is the knowledge they have. But when it comes to human condition, we are all facing the same challenges. We are all facing the same struggles. Your doctor has the duty to educate you on your diagnosis and make necessary recommendations for treatment plans and interventions that will help you. That doesn't negate the fact that they themselves may be struggling with the same challenges or the same health issues. So please do not neglect your doctor's advice because they are not the perfect picture of health that you would like to see, because they may be going through the same challenges that you are going through, right? The difference is that your doctor knows everything about your health, but you don't know anything about them. Remember that they have their own doctor too, and their doctor knows every chronic condition or health issue they are struggling with. I would like to bust a myth that is out here. A lot of people say that their weight is as a result of genetics, but I kid you not, everybody can lose weight. Now, everybody might not have the ability to do so, but everybody can lose weight. Thank you guys. Thank you. Please continue to like and share the live. Everybody can lose weight. Everybody might not have the ability to do it, or the discipline to do it, or the physical ability to do it. But whether your weight is as a result of sedentary lifestyle, a result of medications you take that make you that increase your appetite, or as a result of I don't know, you being a food lover or a foodie, or genetics, if you move your body differently from what you're doing right now, eventually you'll see the weight loss. People get discouraged when they walk out for 2 weeks and they don't lose weight and stop doing it. I'm here to encourage you. Type 2 diabetes, the number one risk factor for type 2 diabetes is obesity because it causes insulin resistance. You may not take it seriously until the day you go to your doctor and they tell you you have diabetes, you need to start taking XYZ medication. And those medications are not cheap. The cheap ones don't work for most people. And the cheap ones have side effects that a lot of people don't like. And so they run back to their doctor and ask for something else. And when the doctor gives them something else, it's something that costs more money. Yes, the insurance might pay for it, but the copay is higher than the cheaper medication. The good news with type 2 diabetes is that now, with the advent of all these injectable forms of medications, they also help you lose weight. So for patients who are overweight or obese and have developed type 2 diabetes, the good news is that your doctor can work with you, although sometimes it's difficult to qualify because of insurance challenges. You can work with your doctor and even some medication manufacturers to get the right medicine that can help you bring your blood sugar down and bring your weight down at the same time. Now, here is the kicker. The medications that help you lose weight, one of the primary things they do is cut your appetite so that you're eating less and less and less. But if on your own you can discipline yourself to eat less and less, then the weight will come off. You may think that you're not overeating, but if your body doesn't need that much food, it's just gonna the food is just gonna convert and store as fat, right? Thank you, friends. Thank you for the stars. Thank you for the FB stars. Thank you for the TT likes and shares. Thank you for being here. I'm Josie. Let me know if you have any questions. Drop a question in the chat. We've been going now for almost 90 minutes, and I'm getting ready to call it a day. And tomorrow I will come back here live. Um, look, look out for the announcement. I'll make an announcement like right before I go live, so that you will know what time I'll come on live. I'll try to do it around 6:30, 7 p.m. ish. And we can build more on type 2 diabetes, or we can talk about something else. You can always ask me anything that is not related to type 2 diabetes. But most things are, right? If you drink alcohol, if you drink sodas, if you drink beer, all those things contribute to weight gain. So somebody asked me, what does alcohol have to do with type 2 diabetes? It's a valid question, right? Alcohol has a lot of calories. It doesn't matter if it's beer, liquor, or wine. Alcohol has a lot of calories. And it also constricts your blood vessels and may cause other issues in your body. It causes you to be impaired, for example. That's one of the things that you eat and you see the side effects almost immediately, right? So alcohol does have a lot of calories, and that can contribute to weight gain, which can contribute to risk factor type 2 diabetes. That's how. Coach Jerry, welcome. Okay, so I'm going to be rounding up. If I don't see any questions in the chat, I just want to say thank you, friends. Thank you for being here. I really, really appreciate. Write down any questions you want to ask me tomorrow. Come with your notebook. Come with your questions, and I'll be here to answer them. My goal is to be able to educate the population, the general population, on little things we can do every day to impact our life positively, to change our lifestyle, modify our lifestyle so that we can sustain this lifestyle for the rest of our lives, right? And live as healthier as we can, because as we get older, especially for those of us who are over the age of 40, right, a lot of things start showing up. LaBelle, welcome. A lot of things start showing up. You start feeling that knee pain. You start finding it difficult to wear those 6-inch heels. You start finding it difficult to, have a good night's sleep most nights. So it helps if we can create a lifestyle that is sustainable for the rest of our lives. Because think about it, if you're 45, I mean, let's use the life expectancy for women is like almost 80 years old. So if you're 40 now, you still have a whole life ahead of you, right? If you live to be 80, you have only lived how many percent of your adult life? Who are the math people in the house? If you're 40 now, you have only lived 22 years of adulthood, right? You have 40 more to go. So, doing everything you can to stay healthy and make sure that you continue on this path for the rest of your life is the best medicine you can give yourself. And I don't remember if I mentioned processed food earlier, but that's another thing. Processed foods are high in calories and have sometimes I call them zero nutrients diet. Eat for the nutrients, not for the calories. If you eat for the nutrients, you turn your life around. Ask yourself, this thing I'm about to eat, is it going to hurt my body or help my body? If you treat everything you put in your mouth as medicine, you'll find yourself eating healthier every day. Because all the medicines that exist come from some source, some plant source, right? So if you can modify your diet to increase your whole foods, natural foods. So whole foods are foods that okay, I don't want to ruin that definition, but I know natural foods are food that are grown in the area where you are. Those are natural. They're naturally occurring in that environment. If you live in Florida, whatever the plants there, that's natural food. Whole foods is the ones that come from other parts, I think. And then organic food is the ones that have been tested and say, oh, this one have 99% of organic compounds versus the one that has fertilizer. That's the difference. Little Victress, welcome back. Elizabeth, I see you. Tomorrow I'll be back at 7 o'clock. I'm gonna start doing this earlier in the evening so um, we don't stay up late on work weeknights, work weeknights. But let me know if you have any questions. I'm gonna round up in about 5 to 6 minutes. What questions do you have for me? Oh, the time zone is Eastern Standard Time, so New York time. 7 p.m. New York time tomorrow. Let's shoot for 7 p.m. tomorrow. We can do 2 hours from 7 p.m. to 9 p.m. You are welcome, little victors. And don't forget to ping me when you go live. I see you sometimes. I appreciate you. All right, we're going to round this up. So, for some reason, yeah, float around me too. I try to learn new things. Yeah,